Okay, so first I want to just introduce what a BBL is. It's a cosmetic procedure that enhances the buttocks using autologous fat transfer, meaning the fat is harvested from one area of the body and then re-ejected into another area of the body, which so happens to be the gluteus maximus. And there are some health risks associated with the BBL, the Brazilian butt lift. The number one thing that I'm going to talk about, which is the most serious risk, is a fat embolism, and that's if the fat enters the bloodstream and travels to your lungs or heart, and it could be fatal. In 2017, a study published in Plastic and Reconstructive Surgery found that the gluteal fat grafting has the highest mortality rate of any aesthetic surgery, mainly due to the fat embolism risk. So let's get into that. I researched an article called Brazilian Butt Lift Associated Mortality, the South Florida Experience. And the most key findings of this that I found really, really important is that 25 deaths in South Florida from 2010 to 2022, with 14 occurring after safety guidelines were issued. So that means they experienced deaths, and then after those deaths were experienced, the board of plastic surgery went back, they created safety procedures, and then they seen additional deaths after that. So
wait a minute, wait a minute. So you saying that prior to all of that, you have people doing surgeries without having procedures in place that could actually impact their life. Did they sign a consent form?
They did. It's different types of consent forms, but there wasn't specific recommendations and procedures of how to do this surgery. So essentially, they were using any type of tips to take the fat, to take the fat, and then they were going in essentially blind with re-injecting the fat into your body, which end up in most cases they injected the fat too deeply into the muscle, and that's what led to the fat embolism and people the fatal outcomes of the surgery.
And women were doing this for the sake of what? Like they were not dissatisfied. Did they have any kind of psychological assessment done prior to altering their body like that? Did they have conversation with themselves?
So yeah, that's not a thing. They don't do any prior like psychological assessments. It's more of if you got that money, you got the flight there, you could get the surgery. I don't think a lot of things that people were seeing, they didn't even research fully. I have some notes up about certificates and consent forms. We have the American Board of Plastic Surgery was the ABPS, and that's the in under other countries they have an equivalent to that. So that's basically who makes the recommendations, who says what is safe within plastic surgery for America. And prior to these deaths, they didn't have like specific recommendations for the Brazilian butt lift. The Brazilian
People were just having this procedure done.
Yeah.
Because they wanted the gluteus to look like a certain way.
Yes.
Because why? Like, where did the premise come from that now it's okay to have, let's call it a big butt? Why is that an issue now? What is happening to women where they feel like they need this?
Okay, so that's where I come in. There's some psychological related events that relate to the surgery specifically in the Black community. So for a lot of these new patients, it's becoming evident that a lot of women are seeking out this procedure and they're not acknowledging the specific potential risk of the surgery, including like complications, the need for ongoing maintenance, and are instead seeking out this surgery due to the way that social media has shaped these new body ideals. Like we've seen this shift throughout society. We went from the early 2000s to where being skinny was in, being as skinny as possible was in, and we've seen this cultural shift into a certain type of body type, especially for Black women. It's a petite waist and large buttocks. And a lot of these influencers and just regular people out there, celebrities, are going through these extreme risks to look this certain way, to have this certain body type. And we've seen it spread throughout our whole society, from women ages 50 and up to as young as 17 and 18. So there has been a general shift towards emphasizing curves and fullness in the buttocks area, which is why women have seeked out this treatment more and more.
So basically, we're saying that we now have a society that's their only concern is to look at looks, the physical looks, So it's no longer about characteristics. So it's all about looks.
It's all about
But
it.
now that we're seeing that this look is actually harmful to them, and we're talking about death. When you say death, we're talking about what, 2 or 3 deaths? What are we talking about?
25 from 2010 to 2022 in South Florida alone.
Just South Florida, but I'm hearing that these procedures are done like different countries.
Yes.
Are they using the same procedures? Or they checking on the women? What is happening? Tell us what's happening to the body and why they think that it's acceptable to do this.
So that's one thing I liked about the scientific aspect of it, is just like seeing how there wasn't proper technique to do it. First off, the BBL just got its name within the last decade. This was a procedure that was done for probably 40 years prior, and there wasn't a name for it. It just was a general like a procedure that they did under the plastic surgery umbrella. So they got a name for it. The BBL didn't start in America. That's why we call it the Brazilian butt lift. It started in Spanish speaking countries, and then it came down to America, and now we see our plastic surgeons essentially doing this surgery. At first they didn't really have to have specific certificates for this surgery as well. When we're seeing certain like safety measures that they put in place to reduce it, was a proper injection technique, which is very blasphemous. Like that's something that's insane, because you were doing injection improperly before, or it was something that was just very unknown. So the proper injection technique is the fat should be placed only in a subcutaneous layer. So that's just below the skin, to avoid penetration into deep vessels. And that's what's causing the death, because they are injecting it too deep into your gluteus area.
And you're saying that we have Black women who's already been known for having
Yes,
curve of thing, and it was okay before that. It wasn't okay for them to be curvaceous.
it wasn't.
Now all of a sudden it's very popular to be curvaceous, and everybody who's anybody, as long as they have money, they're going to have these procedures, whether or not this particular surgeon have been trained to do this.
Yes. Not in the medical field, not all doctors are built the same, and definitely in the plastic surgery field as well. So that comes from a lack of research on the recipient's part, as well as, just general with the surgeons. You should have these certifications, and these things should be put in place. Even before, they were also using different type of tips. So in order to make it safer, they want you to use blunt tips instead of sharper tips, because when you use sharper tips to re-inject the fat, sharper, you end up cutting a little bit too deep into the vein, the deep vessels, which is also what's causing a fat embolism as well. And now surgeons are able to use ultrasound imaging to precisely place the fat while avoiding critical structures within your body, which that wasn't a thing before, which is very interesting, because even when they put these 3 techniques into place, you still seen, let me get the specific number, because I don't want to tell a lie. I don't want to tell a story.
Yeah,
Fact versus fiction.
This is all facts.
Love it, Rain.
Wow. Okay.
Let me just give me 1 second at ease for 1 second. I had to.
She's getting all the facts, so this is based on research. It's not based on our feeling or emotions or anything like that. We have to consider the fact that we were like 25 deaths before they see this is a problem. They were not even considering it. This does not account for women that have done it other places, like the DR, they done other places. People that have traveled over other countries to get this flexible, to get this procedures done. This is just based in the US and just in the state of Florida.
Alone. Yes.
Alone.
Yes.
So then you have individuals paying money to go get this procedure done, and not just for the fact that they don't know there's some risk associated with it. They just wanted to look a certain way.
Exactly.
And go ahead.
But yeah, just so 25 deaths in South Florida from 2010 to 2022. 14 of those deaths occurred after the safety guidelines were issued. So after they said, hey, let's use these imaging to see specifically where you're putting the re-injecting the fat, let's use blunter tips, certificates. 14 deaths still happen in South Florida alone after those recommendations were placed. Majority of the deaths occur in high volume budget clinics where surgeries were often completed in 90 minutes.
Okay, so what's what's the average time they're supposed to be in surgery, recovering? We talk about 4 to 5 hours where they're being monitored by nurses. Are we saying that there's a possibility that is not happening?
90 minutes.
90 minutes.
90 minutes. That's an hour and 30 minutes. We have
That's a class
nutrition classes longer
Longer
than
than that.
90.
I was gonna say.
Our classes are longer. You're going in, you signing your forms, at least when you go to the doctor for regular procedures, you sign the forms, you wait, you wait a little bit of time. The doctor comes, they see what you're talking about, see what type of state you're in. Nope, sign them forms, 90 minutes, you're in and out.
So they're having factory procedures, like you go in?
Yes, in and out. In, no BBL, out BBL. No post-operative care. It's no,
Wow.
yeah, 90 minutes. And then this is a high volume budget clinic. So this means that they have a lot of patients, 90 minutes, and then budget is attainable. Is not unattainable. Like people could get these if you have a certain amount of money. You probably could put a payment on your credit card for a BBL at this point.
So what average cost we're talking about? Like $10,000, $12,000?
For a I have to look that up specifically.
Well, we don't want to give numbers, but what we want to do is inform the audience is that there's consequences to it. What are some of the health issues? Well, death is the final.
Yeah,
blow,
death
but
is crazy.
What about the maintenance? What does that look like?
Taking care of the BBL or traveling, what does that look like?
Yeah, that's what I'm saying. Like, I feel like people aren't even realizing what all goes into this surgery. I mean, it's not only obviously death is the main one, the biggest one, the worst possible outcome that can happen, but this surgery can also lead to a dissatisfactory mindset when the results don't look what the patient expected. And these can lead to mental health issues, which I feel like people don't really think about when they think about the surgery. It can lead to issues such as body dysmorphia. You come out of the surgery, your body looks different. You're thinking, what just happened? Anxiety, you're anxious to show your family, your friends, your coworkers what you look like now. And if the results also aren't what you expected, this could lead to depression. This could lead to bouts of depression. I mean, to reverse the surgery, that's probably another tens of thousands of dollars. You can't even go into it until all the incisions are fully healed. There's just a lot that goes into that. So I feel like people that are seeking the surgery aren't really thinking about the full effects of the surgery. That's also why this danger and pressure from influencers on the internet are really dangerous for surgeries like this, because people are not understanding the process itself, like Rain just explained, and the after effects. For example, we were talking about travel. I feel like it's not even that well known that the patient can't even sit directly on their buttocks for about 2 months. 2 months, guys. Think about how long that is. That's 2 months. You can't sit directly on your butt. I mean, that's planes, that's travel, that's work, that's school, that's spending time with your family. Like, people aren't fully realizing this. And then this also just goes to show that social media doesn't always paint the full picture. Like, and if this is something that you want to do for yourself, you need to make sure you have all the facts about what you're getting yourself into. And I feel like with all of this, there is a general societal pressure for Black women to look a certain type of way. I mean, we see this in our movies, we see this in our music, we see this in our media. You see this on your phone when you're scrolling day by day. And this can create a negative impact on Black women that might not look the stereotypical or expected way. The stereotype being that Black women have to be more curvy or voluptuous by nature. And this can cause Black women that do not fall into this ideal image to feel maybe less attractive or desirable. And this can lead them to seek the surgery out simply based on an existing body dysmorphia rather than the actual personal want to engage in a surgery like this.
Okay, wow. So not just the fact that we have individual participants in surgical procedure that could cause their lives, or what we are saying right here is that we're not telling people what to do. We certainly not, but we wanted to give some of the facts of what to do. And one of the things that I may recommend as a registered dietitian, you may want to consider getting your health together, right? Eating right and exercising, getting enough sleep, get the body healthy, and physical activities. How about that? Look at that.
I know.
Actually get some of that butt lift you're looking for by weightlifting and all that aspect of it, to think about it. And if for those individuals that have had the procedure, there's some nutritional aspect of it that you have to consider. Make sure that you're eating right and you have healthy protein like beans or fish or baked fish or big and beans would help. healthy fats. You're using, instead of saturated fat like pork out of meat, you get your fat from some fish, right? You want to make sure that you're getting some avocados into your diet. You want to make sure that you have adequate vitamin C, so that way we're not impacting the to help with the healing process. But if you are not already not healthy, or you already were out of shape, and you are not physiologically healthy, and you are not nutritional healthy, you went ahead and had these procedures, you could actually enhance or increase your chance, the likelihood of you not coming out alive for these procedures.
Exactly.
So you have young women who's thinking like, oh my God, they're so beautiful, they're so curvy. I think I've seen it in some of the artists, right? Some of them taking it off.
Yeah, I know Kim Kardashian, she got hers dissolved.
Because
so
it was unhealthy.
it was unhealthy.
It was causing her health problem,
yeah.
but she, right? And we have other people taking them off because they're now realizing that the health, but they're not talking about that. They're not talking about the health consequences. But they are, we see people say, oh, you know, look how she looks so great. I'm gonna go ahead and do it. And I remember one of my colleagues mentioned, I believe either the Prime Minister of Nigeria, the wife of the Prime Minister of Nigeria, came to have the surgical procedure and die in the process.
Wow.
You have people trying to look a certain way, when what we are recommending here in this class, issues in nutrition and dietetic, we recommend eating healthy. We are recommending exercise, doing some squat, leg lifting, do some activity, get a trainer. If you want to spend that kind of money, give it to a trainer and work with the trainer to get those butt lifts the way you want them, but without having to put your life at risk, right? Without and matter of fact, physical activity will have better health. You sleep better, you look better, and the overall, the body will be better, not the mental health will be better. But what we are looking to do is, we're not here to penalize individuals, to say for you not to do it, it's not our place. But what we want you to do is to be informed. Be informed about your health. Take your health seriously, because you only have one life to live, right?
Exactly.
Any comment from you? Any comment from Amanda and Lorraine, who did the research to put it together? Any last comment before we finish?
You know, I would say, like, just going over all this information, if I could give a recommendation just based on the research that I've done for patients seeking the surgery, would to maybe be implementing pre-op and post-op counseling. I feel like this would help identify any existing mental health disorders by trained professionals. And it may be an avenue to reroute patients that may be seeking the surgery for the wrong reasons towards different avenues that might be more helpful for the person, such as consistent therapy, support groups, like you said, maybe a training plan, getting in touch with a nutritionist. So I just feel like there are some better avenues for patients that do fit this criteria or ideal. And I feel like it can be rerouted by trained professionals, pre-op and post-op counseling. So that would just be my recommendation based on the research that I've done for this podcast.
Okay. And Lane, you have any last comment?
Yeah. I just want to stress to stay informed. People are going to do everybody has choices, but it's your choice to stay informed and be safe with your body and your life. When thinking about these surgeries, if you feel like this is a necessity for you, just confirm the facility's accreditation. Look at the emergency protocols, the anesthesia, the surgeon's track record. Just if they don't have a detailed constellation, maybe that's not a place that you need to be going. And also look if they have post-operative care and follow-ups for you. Just make sure that you're safe and that you're informed on what's essentially happening to your body, because this is your life.
Absolutely, absolutely. Thank you so much. Great job, ladies. Have a fantastic day to our audience. Take care of yourself. All right.
Thanks, guys. Thank you for listening.